I'm really delighted to be here today. And I think we're going to take a little bit of a walk in this presentation. But the point that I ultimately want to get to is how antimicrobial stewardship is really a key component of pandemic preparedness. And some work that our team has been doing about thinking about how AMR should be included within the scope of this pandemic preparedness instrument that's currently under negotiation at the World Health Organization. So just as a little bit of background, I lead the WHO Collaborating Center, as already mentioned. That's on global governance of antimicrobial resistance. I also lead the AMR Policy Accelerator, which is really about trying to bridge the gap between AMR science and policy. And we're really focused on trying to help countries develop or flesh out the ideas in their national action plans so that they can be implemented in the service of sustainable antimicrobial use for everyone. So this slide is nothing new to this group. Obviously, we all know that AMR is a serious threat to global health and well-being. We know that the magnitude is at least as large as some of the other major diseases that we talk about all the time, including HIV and malaria. We know that potentially it's even larger than that. And that we're looking at deaths and longer hospitalizations and longer treatment times and higher risks associated with surgeries and things like that. And one of the things that I don't think we spend a lot of time talking about is the idea that, Canadians and others in other countries around the world have a kind of expectation that when they seek healthcare, there is going to be a certain standard of care that is provided. And so when I think about AMR and how little we discuss it as compared to some of these more sort of high profile diseases that we're used to thinking about, I think a lot of people are going to be quite shocked when they start going to seek healthcare and hearing that, certain surgical procedures might be too dangerous to do, or that we don't have the antibiotics, the antifungals to support things like cancer patients undergoing chemotherapy. That is going to significantly change a lot about the world. And one of my colleagues has written really extensively about the idea that antibiotics are used in society, not just as medication, but actually as infrastructure. And I think that gets to the core of why people are going to be so surprised when we don't have antibiotics to rely on in the same way as we used to. So humans have obviously intervened by introducing huge quantities of antimicrobial drugs into human, industrial, and agricultural systems. And through that, antibiotics and other antimicrobials have really been used as quick fixes. So there's the quick fix for hygiene, particularly as kind of a replacement for effective infection prevention and control in places where crowding and access to clean water are major challenges. We've seen some research in low and middle income countries that has shown that antibiotics are given prophylactically as a response to the fact that, say, hospitals don't have adequate sterilization of patient rooms or might be overcrowded in those patient rooms. There may be a lack of hospital beds. There may be unhygienic living and working conditions, and people are getting antibiotics really just to fix some of those hygiene gaps. And we do also see the same thing in agriculture, where antibiotics get added to animal feed to preempt disease outbreaks that are due to crowding as well. We also see that antibiotics are a quick fix for productivity. And this is another particular challenge in agriculture, where antibiotics get used as growth promoters because it means that you can bring more meat to market in less time. But you also do see that on the human side of things, where there are people who come into the doctor's office saying, like, just get me an antibiotic, I have to get back to work. And that, I think, is a bit of a replacement for some of the lack of other social supports that we might need to have in place, things like paid sick days that would allow people to actually take time off and heal without that sort of pharmaceutical crutch. We do also see antibiotics being used as a quick fix for care, particularly in an overburdened health system. So there is this sort of common refrain that you'll hear where, we could reduce antibiotic use if only patients would just stop asking for them. But also, a lot of antibiotic prescriptions actually get written as a quick fix for care, because as long as there is a prescription that gets written, patients feel like they were cared for, and physicians tend to feel like they provided some care. And so there is actually some research that shows that physicians prescribe fewer antibiotics when the practice is less busy, when they face fewer time constraints, because they are better able to actually communicate with patients about why an antibiotic isn't warranted in their particular case. And then lastly, we see that antibiotics have become kind of a quick fix for equality as well. And it's somewhat hard to separate that out from questions of hygiene and questions of inequality. But realistically, sort of underfunding of public health care, preventive care, lack of support for those that are living and working in crowded and unsafe conditions often end up with frequent antibiotics, because we're treating really the symptoms of those challenges rather than a lot of the underlying causes. And this use of antibiotics as infrastructure is a real challenge for those of us working in antimicrobial stewardship, because regardless of whether you're using antimicrobials for the sort of good, responsible reason, or whether it's inappropriate antimicrobial use, there is still that potential for drug resistance to develop. And much like climate change, we can achieve sort of a little bit of impact through that individual level behavior change. But the much bigger impact will come through changing structures, like all of these infrastructural uses of antibiotics that I was just talking about. And so whether those are structures at the hospital level, the health system level, or the global level, there's a lot that needs to be done to change those underlying kind of drivers of antimicrobial use. One of the kind of strangest things in my mind is we don't have a master plan for managing antimicrobials as essential infrastructure. Every other kind of infrastructure that we manage, whether it's roads or sewage or flooding, it has a master plan. We know years and years in advance how we're going to manage that infrastructure, how we're going to ensure that it's well maintained, how we're going to systematically prepare in advance of its sort of inevitable breakdown. And so what I've got on the screen here is the plan for managing flooding in my old neighborhood where I used to live in Ottawa. That's a 20-year plan, and it has both a timeline and a budget, which your typical 5-year sort of national action plan for AMR absolutely does not have. And so this is one of the things I think is really key as we're thinking about the next steps in terms of managing the effectiveness of antimicrobials, making sure that we can sustainably use them in the future, is how are we going to manage their use and prepare for what we already know is coming in terms of massively increasing antimicrobial resistance. And that's what brings me to this new WHO Accord for Pandemic Prevention, Preparedness, and Response, which has been under negotiation for the past several months. And you may or may not kind of be up to date on how those negotiations are going. So the goal of the pandemic instrument is really to try and learn some of the lessons from COVID-19. So according to WHO, it was really driven by the need to ensure that communities, governments, and all sectors of society are better prepared and protected in order to prevent and respond to future pandemics. That I think is great. That's one of the things that the COVID-19 pandemic has really clearly demonstrated, that no single country can address global health threats alone, and that we do need to be better prepared to respond to those kinds of emergencies. WHO also gave a second reason for the development of the pandemic instrument. And that is that the great loss of life, the disruption, and the impact on global development that COVID-19 posed require us to prevent a repeat of such crises. And I don't know about you, but that sounds to me like actually a pretty accurate description of a lot of the AMR challenges that we're going to be facing over the next couple of decades in AMR. And that's why it was really, really concerning when the very first draft version of this pandemic accord came out last summer, and it didn't include AMR anywhere within its scope. Because if there's something else that COVID-19 really illustrated, it's how essential antibiotics are to the functioning of our systems and our structures in an emergency kind of situation. So when I think about the links between AMR and pandemic preparedness, there are three things that I'm keeping in mind. The first is that the next pandemic we're looking at could be resistant, or it could be something that develops resistance as we're trying to sort of combat the pandemic at the height of it. We have seen bacterial pandemics in the pre-antibiotic era. I'm sure many of you are keeping an eye on drug-resistant fungi infections at the moment as well. And so just because when we think pandemic, we tend to think viruses, doesn't mean that we should fail to plan for bacterial and fungal infections that pose pandemic threats in the future. And so any sort of instrument that's being developed for pandemic preparedness needs to be ready to address that kind of wide range of threats. The second thing is that antimicrobials and antibiotics in particular are essential for responding to pandemic emergencies. So we know that antibiotics saved the lives of many, many hospitalized patients who got secondary bacterial infections during the COVID-19 pandemic. And we also know that in 1918, before the development of antibiotics, a huge number of people died from secondary infections after contracting the 1918 flu. And I think that's a really strong reminder that these drugs are that essential resource that we're going to be looking for anytime that we're in a pandemic situation and trying to just deal with its effects in real time. And then the last thing that I think about is that the use of antibiotics during a pandemic exacerbates AMR. So we've seen that the use of all of these antibiotics during COVID-19 precipitated a 15% increase in both resistant hospital onset infections and deaths from resistance during the first year of the COVID-19 pandemic in the United States. And we've seen a few different trends around the world across different bacteria and things like that. But overall, I think we can expect that needing to massively use antibiotics in an emergency situation is going to lead to an increase in AMR. And so developing a treaty that's focused on pandemic preparedness and response that neglects to prepare or respond to the growing challenge of AMR is, I mean, at a minimum, I'd say ill-advised. Now, the good news is that AMR has actually now made it into the official zero draft of the pandemic accord. Up to this point, the draft has been in the hands of a technical committee appointed by WHO that does the drafting. But this new zero draft is actually the basis for negotiations between countries. And so that's the stage of all of this that we're getting to now. AMR has been added in, but there's nothing to say that it won't be pulled back out again. And so the key is not to just keep AMR in the treaty, but also to try and strengthen its inclusion. So what we do have at the moment is only a handful of references to AMR. These I have slightly paraphrased because AMR is often included in a sort of long list of issues, and I've kind of just pulled out the AMR relevant piece. But we're looking at one provision that kind of encourages new research and development for new drugs. One element about integrating AMR into pandemic prevention somehow. Taking some action to prevent pandemics from pathogens that are resistant. That is fairly broad, but good idea. And then a couple of pieces about improving surveillance that would relate to AMR, and another call to develop sort of national action plans on AMR that are One Health and that have an opportunity to strengthen stewardship. And this is great, but our team has been thinking a lot recently about how to make these kinds of recommendations crunchier. And we do think that there are a lot of ways in which AMR can not only be integrated into what's already being planned, but actually can come in a way that really strengthens pandemic preparedness as a whole. And so what I want to do is just walk through a few of those ideas. The first one is fairly basic. We shouldn't let that sort of recency bias of COVID-19 cause us to draft a pandemic instrument that only prepares us for threats that look like COVID-19. So if we are to successfully prevent and prepare for future pandemics, then we do need an instrument that comprehensively addresses the full range of pandemic threats. So bacterial, viral, and fungal sources of pandemics and of resistance as well. And hopefully, kind of taking that approach to this pandemic accord can move us in the direction of creating that kind of infrastructure plan that helps us protect antimicrobials from sort of now into the future. We do also think that some small tweaks to the pandemic instrument could actually address some fairly major AMR challenges. And so I just want to talk about a couple of those small tweaks. The first one is very easy. It's important that bacterial pathogens of concern and other antibiotic-resistant pathogens are actually included within the definition of what is a pandemic in Article 1 of the pandemic instrument. At the moment, the current draft text just says, noting that antimicrobial resistance is often described as a silent pandemic and that it could be an aggravating factor during a pandemic. It should be taken into account in the treaty. But I think the fact that AMR is not specifically called out as a pandemic concern, it's more called out as something that could aggravate an existing pandemic. That's not going to be sufficient for us to really capture how integral antibiotics are to pandemic preparedness in the future. So I think including resistant pathogens right there in the definition of what a pandemic is going to make a much stronger case for including all of these things as we go forwards. It's also really clear that there is more overlap than difference that's in the sort of actions that are needed to address AMR and other pandemic threats. So there is a really strong rationale there for including more specific AMR provisions within the scope of this new accord, and so for creating some synergies. So a couple of things that we could do in that respect. First of all, investments in research and development could be hugely helpful, not only in generating new tools and new opportunities for vaccines and diagnostics and new drugs. They could actually do that addressing both AMR and other pandemic threats at the same time. We could also look to assisting other countries by scaling up access to vaccines or pooling procurement for essential goods, or undertaking training and technical assistance in a way that can have kind of profound equity impacts for reducing the inequitable consequences that we've seen both for AMR and for other future pandemics as well. There's a lot of good work that could be done in terms of harmonizing surveillance, conducting global risk assessments, and sharing data samples and sequences that would really speed up the global response to any new AMR or pandemic threat, allowing us kind of as much as possible to get out ahead of emerging threats. And I think when we think about this, a lot of this is infrastructure that will need to kind of come into place to be ready for the sort of future unknown pandemic. And it's actually also an opportunity to really test the systems at the moment, because we're dealing with AMR in real time and we're building structures for an unknown future. Wouldn't it be great if we could test all of those structures that we're building to see if they can help us work through the AMR challenge that we have right now, so that we know that in that unknown emergency, we actually have built something that we'll be able to rely on? And there are also a few key areas where pandemic threats and AMR kind of have overlapping needs, and where we think you could really design kind of dual purpose provisions that create greater impact as we go forwards. So one opportunity is for the pandemic instrument to designate medical countermeasures, including things like antibiotics and antifungals, as a global public good. And what that would allow is the creation of trusted mechanisms that would help expedite their development, ensure that they're available when they're needed, and fund the sort of efficient procurement and the equitable distribution of these kinds of countermeasures all over the world. And the huge impact that that would have would actually be ensuring access. Because we know that to ensure equitable access to medical countermeasures, to ensure that we have impact with all of these medical countermeasures that we're off developing, we actually need to get them into people's hands. So if we can do something that helps create and also create access to all of these different new technologies, we can have quite a lot of impact, both in terms of AMR challenges that we're facing today, as well as any sort of future pandemic threat. And then embedding something like this within that sort of pandemic instrument actually goes a long way towards that idea of the infrastructure master plan. Because one of the key things that something like this could do is actually harmonize and help speed up those kinds of regulatory approval processes that end up being such a huge delay and such a huge challenge to the development of new antimicrobials. And so that would actually really help, I think, solve a very live issue in the research and development world as well. Okay, second one of these dual purpose provisions that could help comprehensively address pandemic threats is integrated surveillance across human, animal, and environmental health, which actually can act as an early warning system that allows for information sharing with researchers and policymakers so that the data that's being collected can actually be used to guide decision making about policies and about research and development efforts in real time. And the lack of this kind of knowledge sharing has, I think, really proven to be a barrier to action in the past. But a pandemic instrument actually could mandate sort of implementation of minimum surveillance and monitoring capacities that go beyond monitoring for established infectious disease threats and actually creates capacity for monitoring the emergence of novel pathogens and the emergence of novel resistance genes all across sort of the One Health sectors. And then last of these sort of dual purpose provisions is this need for trained personnel and lab infrastructure to undertake One Health surveillance and monitoring. And there is a lot that high income countries like Canada could do in terms of helping to create technical capacity and infrastructure for low and middle income countries. Because that lack of qualified people and lab space is one of the big challenges with actually having effective surveillance systems all over the world. And to address these kinds of challenges, the pandemic instrument could actually promote that sort of technical assistance, that knowledge sharing among countries. It could encourage wealthier countries to financially support low and middle income countries that would enable them to meet surveillance capacities, ensure that they were monitoring not only for sort of existing technologies, but actually in terms of building capacity for newer technologies like wastewater testing that would give us a lot more insight than we currently have about the development of resistance, about the development of new pandemics all over the world. So taking action within the pandemic instrument like this to safeguard antimicrobials kind of serves two purposes. One, it would actually help reduce the threat posed by AMR. And two, it would really help preserve what is this essential resource for responding to future pandemic threats, because we do know that we're going to need to rely on antibiotics as we go through any sort of future pandemic situation as well. And so I think given that integrating AMR can kind of serve both of these goals, it does make sense to also include a couple of really key provisions that are specific to safeguarding the effectiveness of antimicrobials. Because if they are a kind of essential resource, we should make sure there are a few specifics that help us safeguard them within the treaty itself. One of these really should be a provision to promote antimicrobial stewardship and to protect the effectiveness of existing antimicrobial medicines. That seems fairly fundamental if we want antimicrobials to work in the future. A second could be to develop a regulatory framework that governs the use of antimicrobials in a sustainable, acceptable, fair, and effective way. And that kind of regulatory framework could actually govern which antimicrobials should be accessed, watched, and reserved in healthcare settings in line with WHO's AWARE framework. As well as trying to sort out which critically important antimicrobials should just be limited for human use and shouldn't be allowed to be used in the animal sector as well. And these, of course, are all ideas that we've seen in the past and we've talked about a number of times. But enshrining them within the pandemic instrument is really a step in creating that infrastructure plan or that roadmap for the future. Because we haven't really seen the kind of support and the buy-in for those types of provisions on a large scale through all of the sort of soft mechanisms that we've had to date. We've talked about these in national action plans and the global action plan, in all sorts of documents that kind of urge countries to do something. But these sort of core actions for managing AMR, I think it would be extremely helpful if we could enshrine them in something that has a little bit more legal might. It creates a little bit more political will to make sure that these are funded and actually have a sustainable program to protect antimicrobials for the future. So I will kind of wrap up here, just to say that, addressing the full range of future pandemic threats is what offers the best protection and the best use of resources. And so instead of trying to just evaluate the lessons of COVID-19 and apply them to future COVID-19 type situations, we do actually need this broader approach. And it's one that kind of really recognizes that core role that antibiotics play as infrastructure, and that core responsibility to protect antibiotics so that we can use them as infrastructure going forwards, and ensure that in any new pandemic situation, we either have the drugs to respond, or we're able to quickly pivot to make sure that we can develop the technologies that we need to get through that. And I think the key here is to build really synergistically. This isn't a case where we need the entire pandemic accord to be focused on AMR, but given the huge number of overlaps between all of this, I think there's a huge benefit to kind of giving sufficient attention to all of these different kinds of pandemic sources so that we are really ready to prevent, prepare for, and respond to all sorts of future global pandemics as well. I will stop there. That's my contact info if anybody wants to reach out at some point. And I will try and stop sharing my slides as well so that I can see everybody on the call.
Thanks so much, Susan. I'll stop recording here.